I'm going to talk about cardiac emergencies, which can be caused by disorders that affect the condition and function of the heart or blood vessels. For example, electrical or mechanical malfunctions, changes in the inner walls of arteries, or trauma. It's important to note that the primary cause of cardiac emergencies in children is respiratory issues. The cardiac conductive system is responsible for the electrical impulses and muscles that cause the heart to contract. Ventricular fibrillation, VFib, is a condition in which the heart's electrical impulses are disorganized. This inhibits the heart muscle from contracting normally. Asystole is a condition in which the heart stops generating electrical impulses. And one condition that can be very misleading is pulseless electrical activity. This condition, in this condition, the heart's electrical rhythm remains normal, but its mechanical pumping does not. So it's hard to detect what's really going on with the patient because you're getting a normal pulse reading when in actuality the mechanical action of the heart is not working properly. And in general, a dysrhythmia is a disturbance in the heart rate and rhythm. Palpitations feel like a fluttering sensation, and they're from a fast or otherwise abnormal heartbeat. So a patient may say that they feel a fluttering sensation in their chest. This is called palpitations. Tachycardia is a fast heart rate. Bradycardia is a slow heart rate. Hypertensive is high blood pressure. And hypotensive is low blood pressure. Acute coronary syndrome, aka cardiac compromise, is a blanket term that refers to the heart muscle not getting enough oxygen. It's important to keep a patient's oxygen saturation at least 94%. A patient with cardiac compromise may complain of dull, crushing, or squeezing chest pain or discomfort, and the feelings may radiate. However, these symptoms are not common in everyone. For example, older patients and women commonly have dyspnea, sudden sweating, or sudden fatigue instead of the pain. A thrombus is a clot which restricts blood flow. It may break loose and become an embolism. Tissue beyond the obstruction may be starved for oxygen and die. So, for example, take a look at this artery that is blocked with plaque. That's going to restrict the flow through the artery, and tissue beyond that point is going to be starved of the oxygen. And to treat a thrombus, a balloon angioplasty or fibrinolytics is used. As I mentioned before, the coronary arteries are the special blood vessels that supply the heart muscle with blood. And coronary artery disease results from narrowed or blocked coronary arteries. Blood flow is reduced, thus so is oxygen delivery to the heart. And this can cause pain. This is aggravated by exertion because of the increased oxygen demand. So say you're exercising, you're going to need more oxygen. And this can be treated with lifestyle changes like diet and exercise, among other things, including medication. An aneurysm is a dilation or ballooning of a weak section in the wall of an artery that may burst and lead to internal bleeding. So, this is very dangerous. This is a very dangerous condition and requires immediate transport. Say this is an artery right here, artery, and this is the ballooning of the weak section. That's the aneurysm. So the aneurysm is the ballooning to the rupture of that. Angina pectoris, aka angina attack, is pain in the chest from the heart muscle being deprived of oxygen. Usually lasts less than 30 minutes, and treatment is administration of oxygen and nitroglycerin. Acute myocardial infarction, aka heart attack, a portion of the heart muscle dies from oxygen deprivation. Cardiac arrest is the cessation of heart functions. And sudden death is cardiac arrest that occurs within 2 hours of symptom onset in a patient with no prior cardiac problems, a history of cardiac problems. So just out of nowhere, death that occurs within 2 hours of the onset of symptoms. Congestive heart failure is mostly caused by COPD. It's the failure of the heart to pump efficiently, which leads to excessive blood or fluids in the lungs, the body, or both. Congestive heart failure leads to different kinds of edema, pulmonary edema or pedal edema. And signs and symptoms include tachycardia, dyspnea, elevated blood pressure, diaphoresis, abdominal distension, and jugular vein distension, which is a late sign. Pedal edema occurs when there's damage to the right side of the heart, which receives blood from the body and pumps it to the lungs. If the left side cannot receive any more blood, fluid accumulates in the dependent lower extremities, for example in the sacral area in bedridden patients. Pulmonary edema It occurs when there's damage to the left side of the heart, which receives blood from the lungs. If it is damaged, fluid builds up into the pulmonary circulation and then into the lungs. And a patient experiences shortness of breath. You may hear rales, which is a bubbly, crackling lung sound. And the patient may spit up blood-tinged sputum. And that concludes this video on cardiac emergencies.